Welcome back, and here we go. As promised, we're going to go into the 10 rules of physician engagement. We're going to start with rules number 1 and 2. And remember, these first two rules are about disengagement and how to avoid it or how to mitigate it. And so that's the key piece. Learn this piece of it, and that'll make the rules, the next next 8 rules of engagement so much easier and so much more likely to be effective. So the first rule is this. If you want physician engagement, then avoid behaviors and language that are known to disengage them. And so I'm going to give you a story. I was in a meeting one time, and it was a department surgery meeting. And we were sitting there, and it was early morning, and everybody was just getting their coffee, and we were just starting the meeting. And there was a presentation by one of our administrators who came in. And as the presentation was going, I started looking around at the faces of the surgeons around the table, and I could see they were shaking their head, and some are starting to already get angry, and some are kind of waving to the chair to get that person's attention, and it became clear there was a problem. I mean, the manager was doing the presentation, couldn't even complete it. There was all of a sudden a lot of people arguing and saying things back and forth, and I thought, what just happened there? And what it was is the words compliance, audits, mandatory, policy, rules. I mean, were somehow all thrown out there. The other one was Joint Commission, CMS. I mean, it was. And next thing I know, the surgeons were arguing about whether we even needed to have the Joint Commission come in and give us deemed status or not, and it just kind of just fell apart. And I thought, holy cow, how did that completely disengage this audience so quickly? And it has to do with a lot of the wording, and that is as if physicians aren't really big on these types of words like compliance, audits, CMS, Joint Commission, and things like that. And I thought, wow, this is interesting. And a week later, the same person came and gave a presentation to our C-suite. Exact same presentation, and nobody flinched. In fact, when she was done with the presentation, there was a little bit of an applause. And the reason there was an applause is because she was delivering good news. She was talking about hospital-acquired infection and the hand-washing compliance rates, and said, we've seen a marked jump in our hand-washing compliance. It's improved. Physicians are washing their hands much more frequently in and out of patient rooms, and we're starting to see some impact on hospital-acquired infection. So imagine that. Someone's delivering good news, but manages to use the wrong words, and all of a sudden completely disengages an audience. In fact, actually, I had to go back and do that same presentation about a month later, and had to present it in a way that physicians were more likely to listen to. And so I'll explain that when we get into the engagement part of it. But for right now, just suffice it to say, you want physician engagement and avoid behaviors and language that are known to disengage them. So rule number 2, if you want physician engagement, then proactively mitigate the effects of unavoidable actions that are considered disengaging to physicians. And so what I mean by this is we had a situation. I was working with supply chain, and we developed a value analysis program. And during the process of that, we had a situation where we were negotiating contracts on a particular product category. And we realized that there were a couple of vendors out there that were really not necessarily playing fair, and they were trying to ramp up their pricing. They had no reason for doing it other than to just increase their prices. And we were going to go back to the group of all of the vendors and say, we're going to come in at a cap pricing model. What that means is we were going to set a price for the products that they were selling, and if you wanted in, you'd get paid that price, and if you didn't, then you weren't on contract anymore. And so we knew that this was probably going to develop some problems with our physicians. So we ran a usage list. And we looked at the physicians and surgeons, in this case, who were using all of these different products and what vendors they were working with. And sat down with the vendors that we thought were going to be likely candidates to walk away from the table. And went to the physicians and told them this. Said, this is what we're going to do. We'd like your help with this. And so they said, well, explain to me the rules around this, and we told them about the pricing and about the fair pricing and how we anticipated they were probably going to try to increase the price, and if we didn't pay, they were going to walk away and use the physicians as leverage to get us to pay higher pricing. And so physicians, listening to this discussion, kind of said, okay, I understand, you've got to do something about the pricing, you're right, they haven't changed the product at all, the price increase, it really isn't warranted. In fact, they had word from colleagues across the country that the pricing was going down, and so they didn't see any reason why we should have to pay extra. Now that worked for most physicians. There was a couple, as it turned out, who were just saying, "Why don't you just pay him and don't bother me with this?" But for the most part, everybody understood it. And so, sure enough, we went to the vendors. We did a price cap pricing model and an all-play strategy. And a couple of vendors, kind of balked, and finally one gave in, and the other one finally balked and walked away from the table. Now, the physicians particularly the physicians who used that vendor, weren't happy. But you know what? They understood. They were willing to work with us because they realized that we came to them first to talk about it. We knew this was going to happen. We knew it was going to cause some problems with some physicians. And we knew that transitioning from one product to another product, even in the same product category, isn't always the funnest thing to do for physicians. But at least they were willing to work with us. And when we started to do that, we really got their attention in terms of being able to say, we're looking out for you first, remember things that they value, and we're also going to help you transition to this new product category if need be. And for the most part, we didn't have to do it because most of the vendors came in with physicians' help. And so that not only helped us, but we were able to help physicians make that transition as a result of that. So it's kind of nice how, all of a sudden we got physician engagement purely because we were reaching out to them. And we're trying to mitigate some let's say some less than desirable outcomes. So that, I think, is another proactive way of doing it, and that's what you have to do. You want physician engagement and proactively mitigate the effects of unavoidable action. So that's a way to remove that disengagement or at least mitigate it over time. And so those are rules number 1 and 2, and we're going to move on to rules number 3 and 4.